Hi, today we're going to talk about what is CRPS. We've divided this into two different shows, and this is part one. Complex regional pain syndrome, or CRPS, has two types. There's type 1 and there's type 2. Type 1 was originally known as RSD, or Reflex Sympathetic Dystrophy, because they thought that it only affected the sympathetic nervous system. With type 1, the injury or illness did not cause a direct injury to a nerve. 90% of people with CRPS have type 1. Type 2 involves the direct injury or illness involving a nerve. Only 10% of people with CRPS have type 2. This was formerly called causalgia. Causalgia dates back until the Civil War. So, some of the common injuries that can cause type 1 are fractures. In addition to the fracture itself, we now know that immobilizing the limb for a length of time can also lead to CRPS. So now you'll see people in a boot instead of a plaster cast. An injury of the soft tissue, such as an IV, something falling on your foot without causing a fracture, but just bruising the soft tissue. Surgery. The most common type of surgery that causes CRPS is orthopedic surgery. Type 2, when the nerve is directly injured, dates back to the Civil War, known as causalgia. So what is CRPS? Well, the symptoms of both type 1 and type 2 are identical. The only difference lies in the type of the injury or illness, whether or not a nerve was directly injured. The one thing that stands out most with CRPS is that the pain is majorly more intense than one would expect from that type of injury. Autonomic dysregulation is when the autonomic nervous system is not working properly. The autonomic nervous system controls internal organs, smooth muscles, and glands. Its function is involuntary, meaning you have no control over how fast your heart beats, that sort of thing. CRPS can affect the digestive system, which is part of the autonomic nervous system. The autonomic nervous system is responsible for the flight or fight response. That means that the sympathetic nervous system lies within the autonomic nervous system. And as I said, they used to think that the sympathetic nervous system was the only thing affected, thus the name reflex sympathetic dystrophy. We now know that it centralizes and affects the entire nervous system. It affects breathing and heart rate, as well as digestion. Some of the digestion issues could be reflux, or it could be that it's moving much too slowly, which is called gastroparesis. We will touch on those things in a later show. CRPS usually starts in a limb And oh, well, crap.